This is AP Med. My name is Andrew Poveda, and I'm interviewing Dr. Sung Choi. He's a pulmonologist. You are a first-year attending, correct? Or second-year? You just started as an attending?
It's a little different. I'm an interventional pulmonologist. So interventional pulmonology, subspecialty within the pulmonary department, where we're focused in more of a procedural perspective. Pulmonary. So I had to do an extra fellowship after the pulmonary critical care.
Got it.
So this will be my first being an attending. Yes.
Oh, okay. Yeah. Tell me about yourself. Very broad, personal or professional. Tell me about yourself.
Good. I came to America when I was 13 years old. And I grew up in New Jersey my whole life. I lived in Ridgewood for a while. And I am a high school dropout. I didn't study too well in the high school. I dropped out of high school. I worked at Dunkin' Donuts and gas stations for about a year and a half. And I took what do you call it?
The GED?
The GED. I took GED, and then I went to Montclair. And while I was in undergrad, I was majoring in biology, molecular biology, and then I was an EMT for a while at Montclair and in a Bloomfield, township of Bloomfield, and that's when I grew my interest and aspiration in medicine. So then I took MCAT, and then I got into MS, and then sort of whole career starts from there.
All right. Okay. Yeah. Wow. You were a high school dropout. How was that for you? Like, how did it get to that point where you, like you mentioned, you were not such a good student. Could you touch more on that?
Of course. So I was after we immigrated here, we're in a process of applying for the green card, and then my mother had ovarian cancer. In my high school years. So basically we spent all of our family money for the surgery and then her treatment afterward. So at that point, we knew that we don't have an option for me to go to a college. I thought that it was a good time for me to stop my education, work, and try to contribute to the family a little. And also, obviously, it was a nice excuse for me to not study anymore, right, at the point. But things worked out. My mom had she was cured from her ovarian cancer, and we got the green card, and I had some time to study, and had aspiration to study more. So I took the GED and went to Montclair after that.
Wow, that's a very complex and unique story. It seems like you really pushed through it though, and now you're at where you're at right now. So, my question would be, how did you get through those hard times where you were like I know typically in Asian culture especially, kids are viewed as meant to be perfect at everything they do, grades wise, talking, putting on like this perfect face for the public. So how did you handle this criticism of other people, like other communities, potentially going after you, and how did you just overcome it?
That's a very good question. Precisely, I think that it's sort of Asian culture that they're viewed. Their view of their children as sort of a trophy, right? And expectations. I have two daughters, and I sometimes view them as a trophy already. They're 7-year-old and 4 years only, but I still do that. It's our part of culture. But I think I was lucky that my parents weren't the typical Asian parents. I was only child, so they should have had higher expectations of me, especially being an immigrant family, as a child of an immigrant family. However, my parents were very understanding. They respected my decision that, at that time I wanted to stop my education and work to help with my family. And even after everything sort of worked out, and when I decided to go to college and told them what I want to do, they were extremely supportive of what I wanted to do. And I don't think I would have gotten here without.
Are you religious by chance?
I'm supposed to, yes.
Oh. Because I've heard
I grew up.
because I've heard this thing from the Bible, and it goes something along the lines of what punishments of God are not gifts, and that's how some people view these obstacles as they view it as something that they need to overcome to become the person that they are, and you basically restated what as I'm saying right now. So
I totally agree.
Yeah.
I totally. I grew up in a Catholic family, so I don't think my mom would be happy if I say I'm not religious. But yes, I agree with that.
So was there ever a point in your career, whether it's in undergrad, medical school, or residency, where you saw what you've been learning, like your education and training, and you thought, wow, I really get to use this experience, and I know how to use this experience to help out my patients? Like, was there ever like an aha moment where it clicked for you and you're like, this is the right career path for me. I'm glad I made this choice.
It's a hard question. If I say that, if there was a sort of miraculous moment where I felt I felt like it was an aha moment, I don't know how many people would have those moments.
Mm-hmm.
But what I can tell you is that throughout my training, medical training, when I was a med student to residency to fellows, I think everyday experience at medical field is fulfilling, and it gives you instant gratifications, but also sort of your vision too. After you finish your long day of work, you look and you see yourself in the future of what you do. And I always felt that the time was always short. Mm-hmm. I was enjoying myself so much while I was working that I felt like, one day should have 30 hours instead of 24 hours. I think that's when I realized that I really love this job, that I love what I do, and that sort of drove me to here.
Yeah, some people really say that the job that you should pick should be something you're really passionate about, and you seem like you just said your 30-hour statement where you wish you could even do even more work. I could tell that you're a really hard worker, and I'm sure your work ethic reflects that as well. So what do you say is the hardest part of your job?
So I think, this is relatively a new field, so I think I might have to elaborate a little more regarding my path. So after I finished my medical school, the 4 years of medical school, I did internal medicine residency, which is 3 years. Mm-hmm. Then I went into pulmonary and critical care fellowship. Pulmonary and critical care is combined. It's a 3-year program. You see pulmonology patients, patients related to pulmonary issues, obviously, but also you're the intensivist. So you're the attendant, you're the doctor in the ICU. So my initial interest was the ICU and critical care. So I spent a lot of time in ICU taking care of critically ill patients. So that's where my sort of passion was. And then the interventional pulmonary is a sort of a new field where I get to do lots of procedures to help with critically ill patients. So that's where my interest. That's where my interest is. This interventional pulmonary field is, again, relatively new field where our bread and butter sort of technology is the lung nodules, and diagnosis of lung nodules is bulk of my job. But also we manage the difficult airways, a lot of malignant central airway obstructions that we debulk and that we treat. Also the pleural medicines, where we manage infection, malignant effusions, and the other etiologies of the fluid around the lungs. Pleural effusions is what I do for a living.
Great summary. Yeah, because heading into this, I think pulmonology, and I think lungs, asthma conditions, treating. So intervention pulmonology is more in the procedure side of dealing with the lungs. Okay, got it. Yep.
I initially went to med school wanting to be a trauma, go to trauma surgery, and I still love the traumas. I still love the trauma surgery the acuity of it. It's just that I didn't really get along with OR, general surgery. I never really felt like the general surgery was my forte. So after I went through a medical ICU experience, rotations, that's when I changed my mind from trauma surgery to it.
You liked the procedure and like the surgery side of it, but you didn't want to do general surgery because you didn't like the lifestyle of being like, I know you're on call for surgery a lot. I'm assuming there's less critical cases in intervention pulmonology where you're not on call and you don't have to be rushed to the hospital. Is my assumption correct, or could you tell me a little bit more about that?
Of course. I think you bring up the good topics. So how much lifestyle would matter in choosing the field that you want to go, right? Any fields that are essential and vitals. What I mean is internal medicine. Within the internal medicine, there's a cardiology, pulmonary and critical care, gastroenterology, and obviously general surgery, trauma surgery, OBGYN. Those fields, you will be on call and you will get pulled at night or the weekends. Obviously, within internal medicine, if you are internist outpatient based, primary care, you won't have as much emergency as you think you will have. But those vital fields, you will have to call. You will be. You will have to sacrifice your time and days, obviously holidays, right?
Yeah.
So to speak. What you brought up, so interventional. First, I think first thing you brought up was that the interventional pulmonary is a field of a procedural field. Yet, I chose not to go to surgery. What I really liked about the interventional pulmonary is that I can incorporate my procedure into managing the patient, right? Internal medicine is all about, we're the field of managing the patients and make the patient get better. And interventional pulmonary uses our procedures to incorporate it into the management to help patient get better. Instead of just, being a proceduralist where I'm not saying, that all the surgeons or other fields are the mere proceduralists that don't care about the patient. Absolutely not.
Yeah, of course.
They deeply care about their and so on. But it's just a school of thought that's different as a medicine, right? Internist. So I really like that field of interventional pulmonary. And again, my primary interest is the airway and managing a difficult airway. That's one of the reasons why I went into interventional pulmonary. So then I get all these emergency calls all the time when emergency room has a patient that has a very difficult airway because, let's say, a lung cancer is obstructing her trachea, then I will get called and I'll have to go in any time that they call.
Got it. Throughout your whole medical career, whether it's undergrad or or medical school or residency, at any point in your life, really, did you have a mentor or somebody you could really look up to in what you want to do, or just a good influence in your life?
I was lucky to have mentors at every field that I went. When I was a med student, I had a great mentor who helped me get through the hardships of the medical school. I'm sure you are aware from the social medias and your mentors how difficult the medical school is compared to residency or fellowship. And when I was a resident and when I was a fellow, I always had mentors that helped me guide. And I think that medicine ultimately comes down to the primary teaching comes from mentor to mentees, right? You always have a mentors that you look up to, you follow, and they tell you the knowledge. It's not just the knowledge from the textbooks, right? But also the knowledge that from their experience, right? That you obtain, and then you use it in your case by case. So I think I was lucky in the sense that I always had good mentors in my life throughout my life.
All right. Oh, this is a big one. How has networking benefited you? Like, people, I know there's a famous quote where it's your network is your net worth. So how have, I'm sure your mentors have really helped you as well, but how has your network helped you out in meeting more people, or people referring to you? Or I know some physicians offer mock interviews and things like in that nature.
So I think that within our field, I think there are two types of networks. So one is the academic network, and another one is the business side of the network. I am just starting my first year of attending, so I'm still learning the business perspective of a network. Mm-hmm. So I don't think I have much to comment on that. But I can tell you about the academic network for sure. Obviously, the most important thing that people look at when you are trying to go to medical school, or when you're trying to go to when you're trying to match residency and fellowship, is how you do, right? Number matters, right?
Yeah.
And they want to see the applicants that they're sure that will pass the boards, right? That's basically what they look for in terms of looking at the numbers. So obviously your research matters, because that makes your program look that makes your program look better, and whatnot. But ultimately, what it comes down to is that they don't know you, so they want to be sure. They want to have an insurance, and that's when your network comes in, right? Having a great mentor or knows of someone who can help you write a great reference letters, who personally knows you, I think just means a lot to, and it helps you get along, so much more than what you can do by having a great network. So I think that aspect, I think it's huge. And it can significantly impact your choice within the medical field. But obviously, that's after after how much how well you've done, basically, right, throughout. So it's not everything. Network is not everything, but obviously it helps you get further than where you can land.
Yeah, it's like an extra thing, an extra step that you could take to help improve you.
It's hard to say it's just an extra, right? Because it plays a huge role.
It does play a huge role, yeah.
I'm telling you from obviously not just for the video, but also for you as well, right? Mm-hmm. Once you get into medical school, and once you want to get into internal, like for example, medicine program that you want to match, right? What you will do is probably it's called away rotations, where at the end of your third or fourth year, you will rotate at the hospitals that you want to match into.
Oh, like sub-Is.
And
sub-Is?
Yeah, sub-Is.
Okay.
Very good. So then basically you're there, show them how well you're prepared, but also, you're networking there, right?
Yeah.
So it's more than just being an extra, but I think that's after, you show yourself that, you're competent, right? So sorry about that.
So right now we're talking about residency and matching into programs. How did you go about it, and what are your tips for doing it? Like you mentioned, sub-Is are like your best times to impress these residency programs, specifically the one you want to match into. So did you do a sub-I at specifically? You did residency at NJMS, correct? Then you went to
Yes.
Mount Sinai for your second fellowship. But do you also do like a sub-I there as well to try to get into the fellowship? How would that work? So that's two questions for the the second one for the fellowship, and the first one of just any tips in general for matching, or any ways to really put yourself out there other than like basic tips of like try to get as many questions right whenever your attending asks you and things like that. Yeah.
Okay, so personally, I don't think I'm a good person to tell you my personal stories, because I had to choose my residency and fellowship based on the location. Unfortunately, I was married. Well, I'm still married, but I was married, and I had two kids. I have two kids, so I was limited to where I can work. Depending on my wife. But what I can tell you from my other, obviously, colleagues who, matched into the programs and whatnot, is that they definitely have done OAs, sub-Is, OA rotations, and they have definitely tried to reach out to the program directors or the faculty members, from the programs they want to match, and try to network there. Mm-hmm. Also, I think it matters to have a good relationship during the conferences that you go to. For example, for pulmonary and critical care, there are annual conferences, such in CHEST or ATS, and you submit your abstracts and your research papers there, and then you get to present there, right? And that's the a time where you can network, right? A lot of my colleagues have asked their program directors when, they go to conferences like that, to be introduced to the other program directors, right, that they want to match. So I think that those are the good chances for residents, medical students, residents, and fellows to show yourself. So that's one first question. And then what was the second question, sorry?
Oh, the second question was, there's sub-Is when you're trying to get into residency, but how is the whole fellowship process work? Like, how did you go about applying for something on Sunday?
So fellowship is a little different. Obviously, when you're trying to get into residency from being a medical school student, on your fourth year, you will have more time than your first 3 years. Mm-hmm. And that's the time you will use to, do extra work, like going to doing a sub-I or whatnot. But your residency is basically you're basically a salary work, right? As we work about 60 to 80 hours a week. Wow. So that's you don't have much time to do OA rotations. Although if you specifically ask and you fulfill your requirement, you are able to do it. But it's hard for you to do so. So I think again, the one that I brought up, a lot of my colleagues use those conferences, kind of familiarize with and network with the people and program directors at the program that they want to manage.
So, why did you choose to become a doctor over another health career, like let's say a PA or a nurse practitioner, for instance?
Okay. I think chose the career path of physician because I think ultimately physicians are the career, the field, the person who makes the ultimate decisions of patient care, right?
Mhm.
I can't function without nurses. I can't function without PAs or APNs, and I can't function without anyone in the medical fields. And obviously, we work as a team. However, at the end of the day, I make the decision for the patient care,
Yeah.
and you take the full responsibility of what you decide for the patient. I think it is a very great privilege to have such ability.
Yeah.
And it's great to see your decision, your knowledge, how your knowledge and your skill can directly translate into the patient care and ultimately the quality of the patient's life, correct? So I think from that perspective, I chose the physician. I chose to be a physician for that.
Do you lead like the admissions committee in any way, or during medical school have you interviewed medical students? Because I know during medical school, some medical students they interview students trying to get into that medical school. So have you?
Not during my medical school not during my medical school nor the residency, but at my fellowship, I was a chief fellow in a pulmonary critical care division. So I was involved in an interviews for the fellow applicants.
Oh, wow. Okay. Do you want to? I know this is a broad question, but do you want to touch upon what makes an applicant an applicant? Like, what makes them? Like, do you see a specific trait in a person, and you're like, yeah, this is the person for this program. This is the person for us. Yeah.
I see. I think from the interviewer's perspective, right? And I never knew this when I was being interviewed.
Mm-hmm.
But if you're in a different chair, you can tell when someone is interested or not.
Yeah.
You can fake it all you want, but at the end of the day, the person who's interviewing you can tell. And I think it comes with the age as well, right? I think as you age, you get to see more people, and you get to see different types of people, so you can tell. So I think you have to fake yourself, even if it is the program that the program that you're interviewing is not a program that you want to get into. You have to fake yourself to act like you're interested, right? And it's not easier than easier said than done, but you have to fake it, or find something that you're very interested at least, right? So it shows while you're being interviewed, and especially these days, everything is a Zoom interview, right?
True.
Like you and I.
Yeah.
So I think in a person to person interview, that you have more ways to sort of fake it, right? Like, a lot of gestures, atmospheres, and everything. Yeah. But in a Zoom, all I'm looking at is your face, right? When I'm interviewing, I'm looking straight at you. Mm-hmm. I can tell if you're interested or not, right? By looking at it. So I think that's the one crucial part, right? In person to person interviews, every gesture can boost your interest or boost your emotions, right? Whatever you want to try to say. But in Zoom, it's purely, really, it's all just the upper torso that you're showing, right? So I think it's more, it makes the whole interview process easy with the Zoom, but it's more hard for both the interviewer and person who's being interviewed to get the feel of what the good program and how the atmosphere of the program is like. So I think it's a
like I
hope it changes, but I don't think we'll ever go back to in-person interviews.
Yeah, especially since a lot of programs are all over the country, then we're traveling, housing to go to these interviews. Yeah, it is convenient for on Zoom, but of course in person you really get a feel of the person. Like you can understand, you can see them as a sense. Yeah.
Because people can tell. Yeah.
Did you ever, like, what was your experience in research? Because I know you're saying that I should try to do a bunch of got my experience up in biostatistics. But how was your experience in undergrad and medical school?
Good. I think that's a good point. So it's very, very hard to be involved in randomized, prospective, large, multi-center clinical data research. Right? The opportunities are very competitive, and it's very difficult to get in. And frankly, there aren't many available to begin with, right? So most of the times, your research will be something like retrospective, or something like QA/QI, or
what's QA/QI?
Or quality improvement.
Okay.
Right.
Yeah.
So it will be something you will come up with very small margins of, let's say I can give you an example of a typical QA/QI. How you can look at how often do primary care at our clinic asks for stop bang for obstructive sleep apnea. Those small criteria, right? Small margins that ultimately helps you improve your clinic or your hospital, something like that. How often do physicians wash after coming out from patients' bed? Something like that. So most of your research will be those types. But if you get into, I think that what the so-called prestigious institutions give you are those opportunities of being involved in large clinical trials, right?
Yeah.
So unless you're in the top tier of the medical school, it will be hard to get into those stuff. So your number will be really case reports, retrospective studies, all this stuff. Just be mindful of those.
Okay. Yeah.
And it still counts. I'm most of my papers has been retrospective case reports and QA/QI and all that. I just recently got involved with the clinical multi-center clinical trials at Mount Sinai, but it's until then it's very hard to get into those.
Yeah, I always hear that research is very competitive, especially trying to get into a research position that you don't have the experience in and they have to teach you. So you're kind of like a liability at first, and then they build you up so you learn more. Yeah. How would you suggest people in medical school put themselves forth as an applicant for these residency programs? Because I know when you're trying to get into medical school, applicants are trying to curate a story of, I want to get into your medical school because I'm this type of applicant, and then you put your extracurriculars, whether you did clinical or research, everything all comes together. But specifically for residency programs, how would that work? How would you be talking more about your research there, or how does that go about?
I think the most optimal scenario is that if you have a personal story with the program itself, I think that works out very, very well.
Okay.
For me, obviously, I was NJMS student.
Yeah.
And then, I went into NJMS internal medicine, so that played out a little different. But also, I was an EMT at Bloomfield, and then I transport a lot of patients to the University Hospital and NJMS. So I had a lot of stories to sort of tell, right? And were other hospital programs that when my mother was admitted for her brain cancers and she had a surgery there, I was able to tell that story to that program, right? So those personal stories, I think, that leaves a good impression to the committees there. But obviously, you're not going to have a personal story to 100 residency programs.
Yeah.
Right? So that, I think, is that sort of is a limiting factor. But if you do a sub-I, right? So I think that sort of continues with the important, me emphasizing the importance of doing a sub-I. While you do a sub-I, then you will have personal stories with the program of your interest, right? So I think that plays a huge role. Then I think that the programs usually look for people who, at the end, right, you will have, for example, internal medicine usually has about 30, 40 residents per year.
Yep.
So then the people skill matters a lot, right? Because they need to make sure that you will be a fit for the program, not dropping out, not arguing with other, specialists, not having an issue with their colleagues, right? So I think leaving that impression also is very important. Then I think the other factors such as your work ethics, research, your numbers obviously plays a huge role. So numbers, just for the addition, the numbers are very important, but it's also used as a cutoff, right? So a lot of programs will use the number to filter out the applicants during invitations. So once you pass that cutoff line with the numbers, so if you got invitations for interview invitations from the program, chances are your chance of getting into the program is pretty high, right? Then it's just really the interview that plays out, leaving a good impressions, basically. Again, leaving a personal story with the program, I think just works best. Yeah.
All right. Okay, so very general question, but what is one piece of advice you would offer to a pre-med to get to the position that you're at right now? It could be something a tip during undergrad, something you wish you did a little bit better. What do you think?
I think you have to understand that getting into this field requires a huge commitment. For example, for me, I spent 4 years in undergrad, 4 years in med school, and 7 years of training just to start. Now I'm, in mid-30s, right? While my other friends are, have started working in the mid-20s, made a lot of money since then. You're still, I was still training in the training phase, not making a lot of money. I mean, I made some, but not a lot of money, right? And it's not just that, but also, I don't remember the last time I celebrated Halloween with my kids, right? Or at Thanksgiving, I would always be off. At Christmas, I will always be away from home working, right? So it's a huge, I think it's a huge commitment, right? It requires a huge commitment. So I think you need to, as a pre-med, you need to know if you're willing to make that sacrifice, or if you're willing to make that commitment to get into this field. And once you know for sure that you are willing to do so, I think everything sort of plays nicely, right? Because you already know yourself, what you're getting into. Yeah. And everything else just comes in as an accessory path just to get into, to reach to that level of your goal, right? So understanding that goal is I think, understanding that commitment is
the key.
Most important.
Yeah. All right. Yeah. I like that answer. Yeah. Next question. So, any thoughts on this podcast? Anything I could improve on? What do you think?
I think this is great. The reason why I was happy to do this interview was because when I was a pre-med or when I was in undergrad, the resources were very limited, right? I think we just started having iPhones then or something like that, so we were very limited. Only sources that I had at the time was a student network, student doctor network. I didn't know I didn't know exactly what I was getting into, even though I knew that I wanted to be a doctor. I knew that I needed to study more. Yeah. But I didn't know what commitment I needed to make, right? So I think your podcast does a great job introducing what the pre-meds or undergrads or the med students to expect. the further. So I think this is a great opportunity. You're providing great opportunities for.
Thank you. All right, very last question. What is your favorite quote?
My favorite quote is, "What doesn't kill you makes you stronger."
Okay.
I think, yeah.
You said that at the beginning. Sometimes people they change up. You know what I mean?
I really think that I'm just reiterating, what I said before, but I think you will face a lot of challenges throughout your career, and I think that each patient gives so much, teaches you so much, and makes you a better person, makes a better doctor. So.
Got it. This is AP Med. My name is Andrew Poveda, and I just interviewed Dr. Sung Choi. He's an interventional pulmonologist, and one theme I would give for him is numbers aren't everything, but commitment definitely is.